Dear Chairman, thank you very much for this opportunity to participate at the EBC 2020. My job today will be to discuss whether intracoronary imaging should be considered mandatory for left main PCI and why compagnonnage could be the best way to go. So how do we go from mandatory, which implies a solid evidence base, to the concept of companionship, which is more or less learning by doing? This concept originates from the Middle Ages, where craftsmen used to, as companions, learn from each other practical skills. So let us first consider the evidence base for intercoronary imaging in left main PCI. These 3 points that you can see on this slide do, I think, nicely sum up the contemporary dilemmas in this field. The first is, what are the imaging markers of an optimal procedure? Secondly, how do we assess the quality of the so far obtained evidence, and what is the emerging randomized evidence? And thirdly, how do we standardize our imaging guidance so that it can be applied in a predefined manner? So to the first point, very early on, and you see this publication from 2011, which I think is familiar to many, was the stent expansion identified as one of the key variables when trying to use IVUS in this case to improve outcomes in left main PCI. Of note, the cutoff points that you see here refer to this particular study, and they were generated in a population of roughly 400 patients who were treated with first generation DES. Now we go to a more contemporary evidence, which is the first all-comer randomized study, the ultimate trial, which proved that IVUS could be associated with favorable outcomes compared to angiography guidance alone in this population. There was roughly 10% left main PCI, so it cannot be extrapolated to all of the left main PCIs, of course. Nevertheless, the criteria that were used here were stent expansion, as previously shown, the key variable, but also the result at the stent edges was assessed. Interestingly, plaque burden at stent edges was, and the cutoff point of below 50%, was the hardest to get. It was the mostly missed criterion of success in terms of IVUS guidance. So this being said, it appears rational to think that there needs to be a set of different criteria that are looked at when using intracoronary imaging for guidance for left main PCI. And this recent study from Dr. De La Torre Hernandez, published in Neurointervention this year, showed that having a predefined set of criteria for IVUS-based guidance will improve ultimately the clinical outcomes as compared to angiography alone, but also as compared to just using IVUS without a clear-cut plan and strategy defined prior to the procedure. Now, in this particular study, different criteria were combined, including stent apposition, stent expansion, and the result of the stent edges, both dissection and the plaque burden. But it also included the look at the proximal stent edge and the proximal stent deformation, which is known to happen in at least 5% of left main PCI cases and is associated with unfavorable outcomes. So to sum up, the evidence base, as we could see, does not contain specifically any randomized study dedicated to left main PCI that was either positive or negative. So it cannot be said that left main PCI should mandatorily be conducted with IVUS or OCT guidelines. There is just no randomized evidence for that. But that being said, I think that we saw enough evidence to realize that imaging can be used as companion in our left main PCI cases because it has practical advantages in identifying areas of possible improvement that could be associated with better outcomes, mainly the stent expansion, and as we could see also, the result at the stent edges. However, there are also other areas, and this is one example, where we used imaging as a companion for left main PCI, which have not been addressed so far in a standardized way in so far conducted studies. And this is, for example, the procedural planning. So basically, in this case, we looked at the plaque composition, and here you see on the right-hand side of the slide, the IVUS pullback, which corresponds to the angio that you see on the left-hand side of the slide. And you see slowly, when you advance from the LAD into the distal left main, the plaque that is existent turns to be very calcified. And here, at this point that you see in the area of the distal left main, there is even a concentric ring of calcium. We use this information to prepare the lesion adequately with a scoring balloon, and we ultimately succeeded in achieving expansion of our stents. So we use the imaging as a companion, independently of the hitherto acquired evidence base. So in conclusion, there is no evidence for mandatory use of intracoronary imaging for left main PCI. Nevertheless, can be used, and it is used as a companion for practical advantage and for gaining practical information that will inform our decision making